What is acid reflux? Acid reflux, also called gastroesophageal reflux disease, GERD, is a condition that can influence grown ups, youngsters, kids and newborn children alike. Anyway, it is brought about by the inappropriate conclusion of the lower esophageal sphincter. This is the muscle right in the middle of your throat and your stomach, which regularly keeps food and fluids in your stomach from coming back to the stomach. Acid reflux is a body disorder caused due to problems related to lifestyle today. There are several reasons for this disorder, but most of them can be avoided. Most important reasons for acid reflux are eating unhealthy and junk foods, mental stress and tension, smoking, drinking, etc. A great many people have encountered acid reflux at one time or the other. Be that as it may, if the acid reflux happens more than twice per week, then what you have is GERD. Now, in the event that it is untreated, a few types of GERD can cause real inconveniences. One of these conditions is erosive esophagitis or aggravation of the throat. The truth is that GERD is generally caused by over-the-top acid substance in the stomach, or food that took longer than usual to go from the throat to the stomach. At the point when these happen, the stomach acid drains back and chafes the throat's covering. And this makes a smoldering sensation in your midsection, or throat, normally referred to as heartburn. Now and then, the acid can get refluxed up to the back of the mouth. However, the most common type of GERD is the non-erosive kind, that is, they don't demonstrate obvious harm to the throat, in spite of the fact that they display other acid reflux manifestations. A few patients have other basic foundations for their GERD. They keep on showing acid reflux manifestations regardless of getting standard GERD treatment. This last kind of GERD is known as refractory GERD. There are different tests a doctor can suggest for diagnosing acid reflux. However, the tests are reordered if the condition refuses to respond to treatment with antacid. In the event that the manifestations persist, a specialist can arrange esophagogastroduodenoscopy, EGD, general nasoporendoscopy. In this system, the doctor utilizes an endoscope to take a look at the upper covering bit of the digestive tract, that is, from the throat, up to the stomach and the first dividus of the small digestive system. Then, the doctor takes a modest piece of tissue to perform a biopsy for a more intensive minute examination. The most exact system for diagnosing GERD is through the utilization of a 24-hour esophageal pH screen. It is a dainty plastic gadget that is embedded through the patient's nose and pushed until it reaches the throat. The gadget records the recurrence and measure of acid that gets refluxed from the stomach for 24 hours. This method is done on patients with ordinary endoscopy results, yet with serious GERD side effects. Treatment of GERD shifts is indicated with the disorder seriousness much of the time. An adjustment in the patient seat and regimenis prescribed foods that up to best stayed away from include broiled foods, greasy foods, caffeine, liquor, citrus leafy foods, tomato items, chocolate, pepper and peppermint. Smoking is additionally discouraged as it represses spit generation. One of the essential elements of salivation is to safeguard the throat by eliminating acids. Smoking can also trigger acid reflux as it builds stomach acidity. Patients are also advised to eat littler suppers and to abstain from resting within 3 hours of eating a meal. This helps patients to keep away upward weight from a full stomach to the esophageal sphincter. This guarantees that gravity is pulling down on your stomach acids, making it more improbable for these acids to get refluxed.